Fostering culturally competent care. How should cultural beliefs on pain management be considered? As healthcare professionals, we frequently encounter patients from diverse cultural backgrounds who may hold different beliefs and express pain differently from what we are accustomed to. Culture profoundly influences pain perception, communication, and coping. Instead of lecturing, our role is to understand, validate, and adapt. Understanding these diverse cultural beliefs on pain management is not merely about cultural sensitivity. It is a critical component of accurate pain assessment, effective communication, and ultimately, the delivery of patient-centered, equitable care. What does scientific evidence say about the impact of culture on pain management? 1. Cultural perception and interpretation of pain. Culture influences the meaning of pain, such as normal aging or spiritual lessons, and to some extent, it also influences an individual's actual pain sensitivity and tolerance. 2. Cultural influence on pain expression and communication. Cultural norms determine how pain is expressed. For instance, stoicism versus overt display, impacting both verbal and nonverbal cues. Misinterpretations by clinicians due to these differences, compounded by language barriers, can lead to inaccurate pain assessment. 3. Cultural impact on health-seeking behaviors and treatment adherence. Cultural beliefs about pain causes and treatments influence whether and when individuals seek medical help, sometimes favoring traditional practices or delaying care. These beliefs also significantly affect adherence to prescribed treatments and the presence of social stigma related to pain. 4. Healthcare disparities and provider bias. Implicit biases among healthcare providers, often rooted in false beliefs about racial differences, contribute to significant disparities where minority groups receive inadequate pain assessment and are less likely to get appropriate treatment. And 5. Implications for pain management. The critical need for cultural competence and humility. Effective pain management requires clinicians to be culturally competent, that is, aware of their own biases, patient-centered in their approach, comprehensive in assessment, and capable of tailoring treatments. It also demands cultural humility, a commitment to continuous learning from patients, and systemic changes to address healthcare inequities. How can you address the cultural impact on pain management? 1. Reflect on your own biases. Regularly examine your own cultural values and assumptions to avoid unconscious biases in pain assessment and treatment. 2. Adopt a patient-centered communication style. Actively listen and use open-ended questions to understand the patient's unique pain experience, recognizing that cultural norms may affect how pain is expressed. 3. Conduct culturally informed assessments. Go beyond standard pain scales. Inquire about the patient's cultural beliefs on pain causes and remedies, and assess their social and socioeconomic context. 4. Develop culturally adapted treatment plans. Co-create treatment plans that respect the patient's preferences and beliefs, potentially integrating traditional healing practices alongside conventional interventions for better adherence and outcomes. And 5. Advocate for systemic support. Support initiatives for diverse healthcare workforces, access to qualified interpreters, and policies that address healthcare disparities within your institution and beyond. Let's put it in practice.
Hello, Mr. Chen. Please have a seat. I'm Dr. Ramirez. I understand you're here today because of back pain. Can you tell me more about how it's been affecting you?
Yes, doctor. It's mostly in the lower back. After work, it feels stiff.
Thank you for sharing that. Back pain is something many people experience, and it can mean different things depending on someone's background or life story. I'd really like to understand what you think is going on.
Well, I think it may be energy blockage. Where I come from, we believe pain can come when balance is off. Maybe I've been out of harmony or overdoing something.
I appreciate you telling me that. In some East Asian traditions, concepts like energy flow and balance are very important to understand health. It's helpful for me to hear how you see this.
My grandfather used to say back pain is the body's way of telling us we need to restore harmony. Maybe I'm being told to slow down.
That's a meaningful perspective. And it's true, pain can sometimes be a signal that the body needs care. While in Western medicine we often look at muscles, nerves, and joints, I believe there's room to consider both viewpoints when building a care plan.
So, is it okay if I still use some herbal treatments too?
Yes, as long as they're safe and don't interfere with any treatments we discuss. Let's also talk about some gentle movements or stretches that could help restore balance and reduce tension. We can build a plan that includes what's important to you.
I would like that. Thank you for listening, Doctor.
My pleasure. My goal is to work with you, not just on your back, but in a way that respects your values and helps you feel better.
To sum up, it is important to bridge cultural differences in pain management by actively listening, validating patients' perspectives, and adapting the approach. This fosters trust, improves communication, and ultimately leads to more effective, patient-centered care for diverse populations.